work on particularly today. Every class is a little bit different. This class today is kind of a core class. I think it scares a lot of women. Obviously, we're not here to do crunches when we're in pregnancy, but just at least giving some information as to what the core looks like now that you're pregnant is more the information that I'll give you, and how we can activate the core muscles while we're pregnant, because it's very different than in our regular practice. Something to consider also postnatally when you guys move forward into having your baby, thinking about the core in a different way. So that's sort of the class today. But if there's anything that you specifically want to work on that's bothering you, it's always nice. Anything like hips, back, any impingements? Just the left side? Yeah. So that's a really great thing to touch on, because we'll talk about this a little bit later, but you have something called the round ligament. And so the round ligament there's an attachment point in the front of the pelvis and then to the uterus. And it's on either side, the left and the right side. And so as the uterus expands, the ligament, it's stretching, right? And so that's usually a lot of pressure, and it is the insertion points, right, kind of in the front of the hip crease. So normal is what it's considered, but still really unfortunate. And usually you can pull it, and you pull it in when women get up really quickly. So when they're laying down, you just shoot out of bed. That's usually when you can pull the round ligament. And it's excruciating. It feels like there's a stabbing pain, right, in the front of the pelvis. So that's an issue. Sometimes getting up from sitting from the toilet and standing up, a lot of women will pull this round ligament. So something to be aware of. It's considered a normal pregnancy condition, but it's not fun by any means. And yeah, go ahead. Oh yeah, and it feels feels like a stabbing pain. Like it. Yeah. Yes. Yeah. And most first-time mums will think that something happened, or they hurt themselves, or they pulled something. It's very internal. And it's a ligament that's stretching, unfortunately. And like every other ligament that's overstretched, you have to be careful. Like you have to just have rest, and you can either use ice if you feel like there's inflammation, but it's usually not, or heat in order to repair the tissue. But yeah, it's a normal thing. And then as you progress in the third trimester, obviously there's more weight on the ligament. It's stretching more, so it's challenging. But I always tell women about the round ligament, because then when I was a doula, the amount of phone calls. So I got this stabbing pain. I'm like, it's okay. You're going to be okay. Just your round ligament. And then they're like, why doesn't anyone tell you this stuff? So now I'm telling you this stuff. That's why I'm here. I was just doing a little prelude to the videos, and I said, like, half of the classes are education, half of them is yoga, because I still feel like it's my due diligence as an instructor to make sure that you're safe, but that you have the first-time knowledge, and hopefully it'll, come down the road where you're like, oh, Claire, thanks so much for talking about the round ligaments.